Thank you very much, everyone, for taking time out of your day to join us at PSHSA's Return to the Workplace virtual conference. My name is Tanya Morose, and I am the Manager of Prevention, Engagement, and Retention for the Public Safety Sector at PSHSA. I am pleased to welcome you to Lessons Learned During COVID-19 in the Police Services Sector with Robert Duncan and Andrew Pendon. Before we begin, I wanted to mention that there will be an opportunity to answer a few questions following the presentation. Please type them in the chat, and my colleague Neil is monitoring the chat. I'd like to introduce our featured speakers. Rob Duncan holds a Bachelor of Kinesiology degree from McMaster University, a certificate in Occupational Health and Safety from Ryerson University, and a master's degree in Disaster and Emergency Management from York University. Rob is also a Canadian registered safety professional and has extensive experience in the field of occupational health and safety. Rob is a member of the Toronto Police Service, where he is currently assigned to the Emergency Management and Public Order Unit's COVID-19 Incident Management Team. And was Andrew able to join us? Well, we hope that Detective Constable Andrew Pendon is able to join us. He is scheduled to join us and has worked for the Durham Regional Police Service for 16 years. Detective Constable Pendon was called upon by command when the pandemic first started due to his experience and skill sets in effectively managing emergency situations. Welcome to our session. Unfortunately, it sounds like Andrew is having some technical difficulties. I know that Rob has lots of wisdom to share, so fingers crossed Andrew can join us. If not, I'm sure Rob will share his lessons learned.
So Tanya, it looks like Andrew's having some technical difficulties getting on.
So why don't you take it away, Rob, and we'll cross our fingers that Andrew is able to get in with some support from our admin team.
Sure, absolutely, I'd be happy to. So good morning, everyone, and thanks so much for joining us today. Thanks to Tanya for the introduction there. So I head up the safety section for the Toronto Police Service, and as Tanya said, I'm currently assigned to the Emergency Management and Public Order Unit as part of the COVID-19 Incident Management Team. So I just want to thank everyone for taking time out of what I suspect are very busy schedules to join us today. And first and foremost, just want to say that I hope that each of you and your families and your colleagues are all doing well and staying safe and healthy. So I certainly don't need to repeat the observation that these are really unprecedented times, but here at the Toronto Police Service, we've been working hard to make sure that our members have the tools and the information that they need to perform their duties and to stay safe on the job and to stay informed in what is, of course, a constantly evolving situation week to week. So among key lessons learned, I think that an early and assertive intervention really made a difference in helping us to respond effectively, and communication with our members has been really fundamental. So I sit on the Services Emergency Preparedness Committee, among other groups, and so we had begun monitoring the situation in Wuhan in late 2019, early 2020, and so we did have some awareness very early on in the process, which helped us to be prepared. It helped us to make some decisions with respect to our preparedness planning, and we've really worked to maintain a really high level of very transparent communication with our members regarding the decisions that are made, requiring the guidance from the service. And we also partnered very closely with the Toronto Police Association, which is our union, and So we've made sure that they were at the table right at the very beginning. And that played a really, really critical role in not only contributing to the decision-making discussions, but also in communicating out to our members and keeping everyone on the same page right from the start, which was very, very important, particularly as we've seen, as the medical research and the medical knowledge of COVID-19 it continues to change and evolve. We've been able to stay on top of that for our members with respect to communication. And of course, there's always more work to be done. And so, among other things, we've been actively seeking feedback both from leaders as well as from our members to help us to continue to fine-tune our response. And I'll talk a little bit about what our response looked like in a moment, just in terms of how we structured ourselves and how we responded. So very early on, we established an incident management team to focus on the pandemic response, particularly when it started to become apparent that it was going to have some fairly significant implications. And so we had implemented twice daily conference calls with our key stakeholders internally to make sure that we were moving quickly to get our planning in place and to make decisions about our inventory of PPE and so forth. So in addition to those calls, we also started with a daily conference call with the City of Toronto's Emergency Operations Centre, which brought the Mayor's Office and Toronto Public Health to the table and allowed us to begin a very coordinated response, speaking to our partners around the city every day to make sure that we were all making decisions in a cohesive way and making sure that the communication that went out to the different emergency services was consistent as well. So that was quite important for us. And we, early on, we established protocols for evaluating exposure assessments, taking into consideration things like payroll and time tracking of affected members. So if our members had a potential exposure or if they required to self-isolate, then well-positioned to manage that right from the beginning. And it did take quite a lot of work initially in terms of getting stakeholders on board. And I think one of the lessons that we learned through all of this was that not everyone felt the same degree of urgency with respect to the global developments. Of course, none of us really expected it to have the kind of significant global impact that it really has. But making sure that we got those stakeholders to the table early on and made some decisions in collaboration with the association to ensure that we had a lot of clarity and transparency for our members in terms of what would happen if they were required to self-isolate. The WSIB claims process was re-communicated out just to make sure that people understood what their rights and their obligations in the workplace were. So we had initially been communicating with frequently asked questions documents, and we were using our normal communication channels internally through our intranet site and via email. But as the response started to evolve, we began to see the need for something a little more structured in terms of information repository. And so we developed a dedicated mini site within our intranet site, which allowed us to post a lot of our communication material, which included frequently asked questions documents, process flow charts, and information, including posters and some internal videos we developed with respect to selection and use of personal protective equipment, donning and doffing PPE, for example. And it created a one-stop shopping environment for our members so they knew exactly where to go for the latest information. We also established a member feedback portal using an existing platform that was already in use in the organization. And we repurposed it to be specific to lessons learned for COVID-19. And so that gave our members an opportunity to basically contribute directly to the response. They could go on anonymously if they chose to, or they could identify themselves and either ask questions, share concerns, or or share ideas. And we actually collected quite a few very innovative ideas and proposed solutions from our members. So one of the lessons learned from that was engage with the members. There are a lot of great ideas out there, and we found that by encouraging people to contribute and to share solutions, we really were able to have a lot of buy-in from our members as well. So that was very, very successful. In terms of the member support, once we started seeing the volume increase, we made the decision to establish what we called a pandemic support hotline. And so that was established by our wellness unit, and it became available 24/7, 7 days a week for our members to contact the hotline team. And they had a number of roles, so they were there to answer questions, to respond to concerns, but they were also trained to do preliminary exposure assessments so that we could provide members with guidance if they were in a situation or a scenario where they believed or knew that they had come into contact with somebody with COVID-19. And they were able to support our contact tracing processes, so we could work hand in hand with Toronto Public Health and develop line lists so that when we did have the need to perform contact tracing and identify which members might be required to self-isolate, we were able to do that through that resource. We also developed an internal website called Stronger Together TPS, and that was an adjunct to our mini intranet site, but was more focused on member wellness and member support. So we developed fitness resources for individuals to stay active when the gyms were closed, resources for working from home, mental health and well-being resources, and even some professional development tools. Sure that we had a good sense, without truly being able to predict the burn rate, to at least have a sense of the rate of usage of the different types and categories of PPE that we issued. So that's been quite helpful. And really one of the key parts of that has been communicating with our members to reinforce the message that as an organization, we did find that although the inventory and availability levels would fluctuate considerably, we were able to maintain an appropriate stockpile for our members, and we were able to issue them within fairly short order. And so a lot of our communication was focused on making sure the members understood that there were no inventory issues, that they didn't need to avoid the use of PPE in some situations because they might be concerned about not having access to it or not having access to enough. So that was very, very important for us to make sure that our members understood that we were monitoring PPE inventories and making sure that there wouldn't be any shortages that could potentially create risk for our members. So we did have a pandemic plan in place, and so one of our first steps in all of this was to review the content to make sure that it was up to date and applicable to the current scenario. But we found that one of the big challenges early on was that there wasn't necessarily widespread awareness of the plan, and so one of the takeaways from that we'll be putting into practice is making sure that we do a regular review of the plan, because certainly as we start thinking about whether there's going to be a second wave or dealing with the fact that pandemic disease seems to be becoming a part of our reality, and so ensuring that we have those regular reviews and have our key stakeholders regularly updated will be a significant contributor to an overall effective response. And so we want to make sure that we're engaging with all of them. And in terms of us, in terms of who those key stakeholders internally were, the response has been led by our emergency management and public order unit and the incident management team that's been established. But our wellness unit, including our medical advisory services and our safety section, have been very, very instrumental throughout all of this in providing the expertise and support and running the pandemic support hotlines. So that's been really critical for us, along with our corporate communications team and our facilities management our fleet materials management teams, as well as our labor relations specialists who work very closely with our association to look at concessions that might exist in the collective agreement and so forth, and the Toronto Police Operations Center. So we've had those key stakeholders on board from very early on and ensure that they were clearly communicated with and given an opportunity to contribute to the response as it evolved. So Tanya, I'm not sure if Andrew has had a chance to join us yet. Did he come on?
No, Rob, I don't see Andrew in. I think at this point, there are no slides to see. So if you can hear us speaking, then you've got what we have to offer right now. There's not a slide deck for this presentation. Rob, do you have more to share, or would you like to take some questions?
Well, if you like, I can just share briefly what our return to work plan looks like, and then we can open it up for questions.
That sounds great. So for the folks that are listening, if anything's come to mind as Rob has shared, if you wouldn't mind just popping them in the chat box, that would be wonderful. Then we'll go through them after he shares the return to the workplace.
Yeah, so certainly as with every other organization when the pandemic was first declared, obviously as a police service and an essential public service, we've continued to operate throughout this entire pandemic period. However, of course, with certain modifications, particularly with respect to our civilian members and some of the members who work out of support units in our headquarters building. And so in alignment with the guidance from the public health authorities, we did move a number of our members to a working from home model. And almost as soon as we did that, we also started working on the return to normal service delivery plan, because we knew that a lot of our roles and positions require on-site engagement, and not all of those positions can work from home effectively. And so as soon as we sent people home, we started working on our return to normal service delivery plan, absent the dates, of course, because we had no idea what the stages or phases of the recovery would look like. But part of that process involved developing a guidance document for our managers and for our senior officers and for our command to guide each unit through the planning process, because we have workplaces throughout the city, and some of them are very unique in terms of their structure and layout and their purpose. And so our return to work guidance document was primarily designed as a tool to help those managers at each of those units and facilities to look at their workplace and consider what kind of changes might be required and what resources they might need as they think about bringing people back when they have been out of the workplace. And I should mention a little plug for the PSHSA here. They have some excellent resources on their website that we certainly use to support our decision making. So if you haven't looked at the PSHSA website, I would definitely recommend that. And then through this process, now that we have started looking at what it's going to look like when we're bringing people back, we've established a team comprised of myself and some of the other members of the incident management team. And we're actually doing site visits at each unit and speaking on site with the managers and speaking with the members who are in the workplace to talk to them about what exactly their concerns are, what resources they think they need, and to walk through their return to work plan. And yeah, I would say that that's been extremely successful because it gives us an opportunity to address those concerns. There was some discussion in the keynote this morning about the anxiety or the reluctance some people might be feeling coming back into the workplace, or even taking transit to get to the workplace. So there are a lot of things there that we are able to address right up front in a very transparent manner with the members and with the managers. And trying to give them the tools to speak to their people about their concerns and make sure that they know what types of resources are there for them. It's also been a very, very, very good way for us to dispel myths and to reassure each unit that the organization takes their health and safety seriously, and that the decisions that we're making are aligned with the public health authorities. And so we reiterate that message each time we do one of these site visits. And so far we've found that they're very, very successful because it does give the managers and the supervisors a little bit of one-on-one time to talk about concerns that might be quite unique to their workplace. And so that's sort of in a nutshell what our responses look like. So if you like, I can open it up to questions now. Really usable, highly applicable resources. And I think it's just an excellent job that you've done providing those tools. I'd also recommend for emergency services to participate in some of the existing forums that are out there. So the Ontario Police Health and Safety Association is one, of course. I find that we work best when we're collaborative and we're working with our colleagues and talking through some of the challenges that we face. In the emergency services, we have some very, very unique work that we do, some very unique challenges, and it's very, very important to try to build those relationships up front to make sure that, they always say that the worst time to be handing in business cards is in the middle of an emergency. And that's very, very true advice. Establish those relationships up front. I know certainly for myself, I spoke to my colleagues at other services, speak to my colleagues at other services regularly. And we're also always very happy to provide resources where we can. And so I had members of my network of colleagues reaching out, asking questions about what our approach looked like, or asking to share documents and guidance materials that we created. So we're certainly happy to do that. I think a lot of this is it's about relationships and making sure that you know who to reach out to and something before in the middle of an emergency.
Thank you for sharing. Rob, I'm not sure if we are live or not. On my end, it does look like we are live, but there were a couple things that popped up. So I'm not sure where the problem is. For some reason, Neil has to keep restarting the broadcast. Okay, we are back live again. Thank you, Derek. We're aiming for progress over perfection. Does anybody have, in the couple of minutes we have remaining, does anybody have any additional questions for Rob? All right. So Rob, Neil wants to know, have you had any outbreaks in any of the units or divisions at Toronto Police Service?
We've been fortunate not to have had any outbreaks. We've been able to contain them and identify the exposure had occurred very, very early on. And so we've certainly had cases where we've had members having to self-isolate as a result of their exposures. In terms of total COVID positive cases, we've had 27 thus far, and of those 22 were sworn police officers, 5 of them were civilian members. And one of the interesting things that we found is actually that they're not coming from occupational exposures. We're seeing all of our exposures coming from, early on they were travel-related exposures, but currently they are exposures in the home, typically where a family member, we've had a number of family members who work in long-term care or work as nurses in the healthcare system who've been exposed occupationally, and then that's resulted in the exposure to our member. So we've had those 27. Of the 27, 18 have been cleared to return to full duties following 14 days symptom-free. free, and we're doing double negative tests as well to return people to work. So that can sometimes take a little bit of time in terms of getting people back.
So that's, while it's unfortunate for those members that did acquire COVID-19, it suggests to me that the measures and procedures that we're putting in place in the workplace are effective. And we do hope that for the other 9, they get their a speedy recovery, a full recovery, and that double negative test in not too long. One last question before our session ends. Rob, did you implement any group teams or cohorting to manage spread or prevent spread in the workplace?
We actually have kind of a de facto structure that creates that. So members are assigned to a specific platoon, and they go through their shift rotations on that platoon. And that's the case for a lot of our units, both sworn and civilian. And so that does actually contribute to that as well. We also made some changes about the layout of our parade rooms, for example, and that sort of thing. So we started parading members outdoors or in virtual parade rooms in some cases, depending on the nature of the unit. So we did try to put the physical and social distancing procedures in place wherever they're practicable.
All right, thank you for sharing. In order to give people, unless I don't see any other questions in the chat right now, I'll give you a couple minutes to think about anything else that you may want to add. Andrew, I'm sorry that the electrical gremlins got the best of us today. I would have appreciated hearing your perspective on what Durham has done. And Rob, thank you very much. It's always a joy to hear you share your experiences, and I know you do share very generously with others about your experiences at Toronto Police Service and the lessons learned as we progress through really unprecedented times together. Thank you to all of you who chose to spend some time with us today. We do have a very full agenda with a very strong public safety presence as we progress through the day. I would like to let you know that we do have the Trade Show and Research Expo, which is open all day. Right now, you can learn about research from Dr. Arne Ruckert at the School of Epidemiology and Public Health at the University of Ottawa. The research that they are sharing is health equity in the COVID-19 pandemic, the role of social determinants. There's another slot of presentations coming up at 11:15, so please be sure to join them. If you need to get to the expo, what you'll need to do is go back to the lobby and then click on the expo tab or the lobby tab if that's where you want to be. Again, thank you very much, Rob, and to everyone else, I hope you enjoy the rest of your day.
Thanks very much, everyone. It's a pleasure to be here.